If you fracture your hip in the subsequent 12 months, there's a 30% chance that you will die. There's a 30% chance that you will never regain any amount of independence, that you'll be required to be in a facility or have full-time care.
At what age if this happens?
This is technically over the age of 60, but I've seen this in people under the age of 60. And so then that leaves only 30% of people that have a hip fracture that regain any kind of independence. Of that 30%, though, after 6 months from injury, they still can't walk across the room. When people say, oh, I'll worry about osteoporosis later, no, because if you have this fracture, it's too late. And it will significantly change the lifestyle of both you and those that care for you.
Welcome to the Dr. Ashley Show.
Welcome to the Dr. Ashley Show. I'm Dr. Ashley, and I'm so excited about today because I've got a guest who is near and dear to my heart that I love very much, and I'm sure you all will too, and that is my husband, Dr. Doug. Dr. Doug is double board certified in both orthopedic surgery and anti-aging longevity medicine. He's got a lot of training under his belt, and I'm so excited to have him here to talk to us about bone health and just overall great well-being. He's the owner and founder of Optimal Human Health and Optimal Bone Health. So today, Doug, thanks for being here with me.
Thanks for having me.
Taking the long trip across the hallway into the recording.
No, oh my gosh, but I made it on time.
Yeah, you did. Good thing. Well, will you share with us today all that you know about osteoporosis and why is osteoporosis something that's important that we need to focus on?
Yeah, well, I'll just start with that first question because I don't think we have enough time to go into all of it today, but we'll hit the highlights.
Great.
So osteoporosis is something that actually we created out of our Optimal Human Health company, like you mentioned, because there was such a need and there is such a void of providers that are trained in the space. So my background as in orthopedics led me to treat patients surgically with osteoporosis because they had fractures. Mm-hmm. But when I got into the functional medicine space and the integrative space, I recognized that the way that I was treating patients, people that were coming out of PhD, people that were coming to me just wanting to feel better, to perform better, to look better, that approach actually was perfect for osteoporosis. And so we started helping people with osteoporosis. The challenge that people with osteoporosis have is that once they get a diagnosis, which we can talk about when that is and why it's generally too late, but once they get a diagnosis, there is just so little information that makes sense. There's a lot of conflicting information, like in so many health conditions, especially chronic ones. And the people that were out there, the doctors that were available to them in the traditional medical system were not providing them what they wanted, which was in general to reverse osteoporosis without taking the drugs.
Is that possible?
It is possible.
Really?
Yeah, we do it every day.
Do you?
I do.
Well, why do you have this bone here?
I have this bone here in case you had questions about what a hip fracture is.
Oh.
Because a lot of people actually don't know what that is. Okay. And because of, again, my background in orthopedics, I have all these plastic bones laying around.
Props with you.
So I like props, but we can talk about that later.
Oh, okay. So then who should worry about osteoporosis?
Yeah, so this is really tricky. So if you look at the guidelines for diagnosing osteoporosis or testing or screening for osteoporosis, in the United States and in most countries, the screening process starts at 65 years old for women and 70 years old for men, which is way too late. Mm-hmm. And I understand from a public health perspective why they do that. They do that because that's when you're most likely to catch the problem. But we don't want to catch the problem and put people on drugs. We actually want to find out if you are at risk for the problem or have it early so that you can slow it down, stop it, and reverse it. So for me, if I had my way and just could test anybody I wanted to, I would actually test every adult, male and female, actually in their early 20s or 30s.
Yeah.
Now that's not realistic. But the reason for that is that peak bone mass, meaning that when you have the most bone density, the most bone quality, is in your early 20s and 30s. So many, especially women, but men too, will go through adolescence, have whatever risk factor it is, diet, lack of exercise, lack of sun exposure, vitamin D deficient, whatever it is. So many reasons why they might not have good peak bone mass. And then if they don't, then they are on a hopefully gentle, sometimes not, slide from their 30s and 40s with their bone mass all the way down into whenever they die. And so knowing where they are early is better. Realistically, I would say for women, definitely in their 40s as they approach menopause and knowing exactly, what is my bone like before I go through this thing called menopause. And then for men, really understanding the biggest risk factor is lack of testosterone, which is an epidemic in our society. So understanding that if you have low testosterone, if you have high levels of stress, if you have these risk factors that go along with bone health, to get screened early too.
Well, I have some personal experience with that because when I was getting my PhD in nutrition, part of my study was getting DEXA scans on all of my control. And
Including me.
I did a DEXA scan on you, didn't I?
You didn't.
Yeah. So I had that done and I came back having osteoporosis. And that was really scary. I was, mid-20s?
Yeah. And I had osteopenia.
Yeah, you did.
Yeah.
But I no longer have that anymore.
Yeah. I still have osteopenia.
Oh, you do? I don't know why mine reversed because all of my nutrition changed.
Yeah.
Living the PhD lifestyle.
You're eating a protein forward diet. Your resistance training.
Yes.
You got your hormones under control. All those things.
Great things. So then, is that how you test for osteoporosis, is a DEXA scan?
Yeah, it's the best screening tool out there because it is abundantly out there, right? Everybody worldwide, for the most part, has access to a DEXA scanner. So it is a good way to identify bone mineral density problems. It is not the best test out there. The test that we prefer is an ultrasound study called a REMS, but REMS is just not widely available. I think last count, there's only 4 in the United States, but one happens to be in Asheville.
Yeah, that's crazy, you guys. So if you're listening to this and you live in Asheville, you could get one of those.
Yeah.
Do you have to get it prescribed from your physician, from your doctor?
Yes and no. So if you want to try to get your insurance to cover it, then it has to be prescribed. But if you are under the age of 65, they typically won't cover it. You can try to argue that you have a pre-existing condition, you have a risk factor, and sometimes they will, but it's not particularly expensive. So I would say you don't really need one. You just go and get it. If the imaging center requires one, then you have to do that. The REMS you don't need. It's a cash pay thing, and you just go to the providers that have it.
I see. And to get the DEXA scan, do you have to have that prescribed too? If you're before the age of 65?
Often, yeah.
Oh. But usually you can go to your doctor and just say that you're concerned and they should do that for you?
They should.
So then should folks worry about osteoporosis if they're carrying around excess fat weight, if they're obese and overweight, or does carrying around that extra weight actually do good things for the bone?
Yeah, so this is a really interesting misconception. And it's interesting because I've even seen this in my YouTube channel where people will say, well, I was diagnosed with osteoporosis, so I gained 30 pounds, so I wouldn't have to worry about wearing a weight vest, which is one of the things that we recommend. And unfortunately, if you gain weight through fat mass, then you are, as you talk about all the time, you are increasing your inflammation. You're likely having a negative impact on your thyroid. So all of the things that we know that are bad for bones increases with increased fat mass. So yes, you are pushing around more weight and that will have an impact on your muscle, but we often don't see people gain fat mass and gain much muscle. Right. They don't get more muscular underneath that fat. They're just getting fat.
They're making their muscles look like a Kobe beef steak.
Right.
And not that beautiful grass-fed steak that we all want.
Right. So the answer is I would not recommend putting on weight. Because I think it's going to be a negative. And if somebody has been overweight and they think that that's protecting them, they're wrong.
So wear a weighted vest.
We do like weighted vests. There's a lot of ways that you can impact your bones throughout the day, but a weighted vest is a fun one if your spine can support it. But it's one of the best ways to actually load your spine, which is one of the more challenging things to do because we don't generally load a lot of weight through our upper body.
Yeah. So can you give us like the top 5, 8 things that folks can do to benefit their bones?
Yes. So, I mean, I think the number one thing is we talk about this in our framework of diagnosis, which we call it the 4R method. So the first R is to recognize why you're losing bone. So this is testing, right? So this is our blood tests that are included in our full service program, maybe functional testing to look at the gut. In that blood test, we're looking at hormones, we're looking at thyroid, we're looking at adrenal function, we're looking at other potential risk factors for health span. But recognizing why you're losing bone is really important because if you don't do that, then you can't do the second R, which is to reverse those causes of bone loss. If you don't know why you're losing bone and your doctor's recommending drugs, those drugs actually might not work because you're not actually addressing the problem, right? If you're not rapidly losing bone and you get put on a bisphosphonate, which was designed to poison osteoclasts, the cells that break down bone, and slow down bone loss. But if that's not your problem, it's not going to work. So you really got to know why. So that's number one. And then number two, reverse those causes of bone loss. So then you're going to direct it at those things. And so then for most people, this is an issue with hormones. Again, we're dealing with perimenopause and menopausal women. So we're talking about hormone replacement. For men, we're talking about hormone optimization, potentially testosterone replacement. And there's a whole long conversation that goes along with that. But that is one of the biggest, or in the case of women, three of the biggest tools that you can use to do that. So that's a big one. If you have gut dysfunction. Nutrition is a huge thing. We are such advocates for a very similar diet as PhD, but in the maintenance phase, which is a protein forward from animal products diet that is anti-inflammatory in nature and minimizes highly processed foods, added sugars, all the garbage stuff that is so abundantly available to us. So once you hit all those things, then you have to start actually loading your bones. Because I had a great example of this with a patient recently. She was doing all the things, but she was only loading her hips. So at the 6-month mark, she got a repeat REMS, which is actually too soon. So don't do that. But it's too soon because it takes time to mineralize bones. But she had over 10% increase in her bone mineral density in her hips. That's like better than any drug on the market with no side effects. Amazing. But her spine got worse. So why did her spine get worse? She had all of the building blocks available. She wasn't loading her spine. I didn't know this because she didn't tell me, but she has a history of back pain, and she was afraid of loading her spine. So she was doing all this weight training and all this resistance for her legs, but she was never doing anything that loaded her spine. And her spine, even in the face of all of this proper hormones and supplements and nutrient repletion, her spine still got worse. So we got to load it.
So then how do you load your spine if she's dealing with those spine issues? Because as we know, I have my own spine issues and have an MRI waiting on your desk to review for me.
I know.
And I haven't been able to wear the weighted vest in a long time because I'm nervous on the impact for my sciatic nerve. So how does someone like her or like me load spine?
Yeah. So for you, we still don't know the problem. So we will find that out and we will
be determined.
Come up with a great plan. For her, similarly, actually, she just didn't want to go to the orthodox. She didn't want to get an MRI. But she's just been not loading her spine. So this was actually a really good for her, especially because we did it at 6 months. So now she's got doctor's visit scheduled. She'll ultimately, get x-rays and an MRI. We'll figure out what her alignment really is and what is her pain point. She's been working with Dr. Nick Truby, who we both know, and he works with clients on our platform. And so he's been finding ways around it. He's been able to look at her posture, her form. We're able to load her through her arms, and she is actually also able to wear a weighted vest. She's starting light, which is fine. Because I think with all of the good things going on, this, anabolic milieu of hormones and peptides that she's on, I don't think she needs to do much, but she's got to do something.
So then from all of these reasons, you see that people have osteoporosis. Is there like the top 3 most common that you see and ones that would surprise people? Like, is gut health a common reason why? And then what is it that you're seeing in people's guts?
Yeah, I mean, I would say that the most common is loss of sex hormones with menopause. And then I just did a video on this in men. So for women, it's predictable, right? Every woman, if you live long enough through your 50s and 60s, you will go through menopause. There's no way around it. But for men, it's much less predictable. And I just did a video on this because men's testosterone levels, we tested in our health optimization side, every patient. I see men in their 40s, 30s, and even 20s with low testosterone. Testosterone in men is how you make estrogen. It's how you protect your bones. And if you don't have that, if you have low testosterone, you're going to have low estrogen. And this is never tested in the traditional medical model. That's a surprising one. And so I think a third of our patients are men. And statistically, that doesn't make sense. And they're also younger. So we don't have old men with osteoporosis. We have young men in their 40s and 50s with osteoporosis, which is interesting.
Well, I'm a little confused because when men have low testosterone, usually they're taking aromatase inhibitors to inhibit the estrogen, because we find at PhD that when men are carrying around this excess fat weight in the stomach, this visceral fat actually takes their testosterone, lowers it, converts it into estrogen through aromatase. So I'm a little bit confused on the low testosterone and low estrogen levels.
It depends on why.
Okay.
Right? Unlike PhD, not all of my patients have a lot of visceral fat. I know. And so most of my patients are actually relatively fit, and lean-ish, for our population. And so they don't have that problem where their testosterone isn't low because of excess visceral fat and excess aromatization. Their testosterone is low for any other myriad reasons, which could include, stress, adrenal dysfunction, poor sleep, not exercising, poor sun exposure,
I see.
all of the estrogen toxins that are in our environment. So all of those things combined together will reduce testosterone. So probably not for the same reason.
Got it. So we talked about hormones being pretty much the primary reason why we see poor bone health.
I think it's a big one, but honestly, you said, you mentioned gut health, and gut health is something that we look at very closely. In fact, we're just hiring our third gut health specific functional nutrition RD because we work extensively with our patients on their gut health. So if you're asking what is the dysfunction, it could be a lot of different things, but often it's poor enzyme function. So they have low hydrochloric acid, they have poor pancreatic enzyme function. They don't break down fats well, they don't break down protein well. So poor function is a big one. We also test microbiome. We look for parasites, we look for H. pylori, and we do a very extensive panel and then treat whatever it is. And it is consistent that it is almost always a problem. And we're always putting these patients on a gut health protocol.
Do a lot of people have H. pylori?
Not in my practice, no.
Parasites?
More often than you think. Yeah.
Just our kids.
Just our kids.
Our son has H. pylori and our other one has
Had a parasite. Yeah. It's great.
So they do happen, and we feed them good water. I swear they're not like drinking out of the chicken water.
Not here, anyway.
Not that we know of. They could go down there and have a little tea party going on.
Who knows?
God. Okay, well then talk to us a little bit about why you think animal protein is helpful for bone health.
Yeah, so this was actually the third thing I was going to mention, which is there is this really unfortunate bias and trend in the bone health community to push people toward a vegetarian or vegan diet. And it is done so, in my opinion, with the right attitude and in the right spirit, which is there is this belief that alkalizing your body, controlling your pH through eating a plant-based diet will improve your bones. The problem with that theory is that, first of all, it's not true, but the evidence that supports doing it is all based off of animal studies, and there are more studies to show that that's not true than there are studies to show that it's true. So I don't want to dig into that because it would take forever and it's boring. But basically, the animal studies show that it is possible to simulate losing bone by eating a protein-forward diet, but not in the face of adequate calcium, and we're not mice. So if you look at the human studies are really clear. If you eat a vegan or a vegetarian diet, the further you get away from animal products, the more likely you are to have a hip fracture. 2 to 3 times increased risk if you eat a vegan diet over an animal protein diet. So in humans, this doesn't play out. And that even is on top of the fact that every study on vegans and vegetarians is going to be influenced by the healthy user bias, which means that these people are already making other healthy choices. So despite the fact that the meat eaters are more likely to smoke, they're more likely to be obese, they're more likely to eat processed food, they still fracture less. So this is a huge thing that I see in this community, and I stomp as loud as I can to try to bring this up, which is we don't need to change what we eat to impact our pH if we're eating a whole food diet. We do not need to consume alkaline water. We do not need to consume green powder to go along with our whatever to try to alkalize our body. The body, as a surgeon who's been in the operating room in the ICU with patients that have a true arterial line where the only way you can actually measure pH, it does not change with what you eat. If I feed somebody in the ICU a cheeseburger, their pH in their blood does not change.
Interesting. Yeah, there was a study that just came out looking at red meat and it's associated with increased longevity.
Right.
And they said that any study that doesn't take into consider lifestyle doesn't have good foundation or evidence, can't be considered, because you really have to consider the lifestyle when you're looking at what people are eating.
Right. Yeah, it's a huge thing, a huge issue with epidemiology and cohort studies with meat versus plants. The healthy user bias is nearly impossible to account for.
So then my last question for you is, what about the drugs? You talked about bisphosphonates. I know that on your YouTube channel that's growing wildly every day, you had a really big popular video on, I think, bisphosphonates.
Yeah.
And so what did you share in that? What created all of the hubbub?
Yeah, it's because I put a video up there that said the worst drug for osteoporosis.
Oh, it was a good title
Yeah,
there.
it was a really good title. But the reason why it drew attention is that people are afraid of the drugs, and they should be.
Why?
The side effects of bisphosphonates and another very popular drug called Proleum, which is also an anti-resorptive drug. I'll explain that in a second. The anti-resorptive drugs, which poison the osteoclasts, slow down or completely eliminate bone breakdown, have the side effects of two main things. There's some other mild ones, but the two main ones that I worry about are more rare, but one is called osteonecrosis of the jaw. And if you are squeamish, do not Google that. It is terrible. So basically what happens, the mandible and the maxilla, the two jaw bones, they turn over bone very quickly. It's because they have the teeth in them and they're always being stressed and all this. There's a lot that goes on in your mouth. And if you go on a bisphosphonate, that turnover gets squashed, right? The bone metabolism is just eliminated. And then you end up developing some kind of a jaw problem, a tooth is loose, and we're dealing with aging people that are going to have tooth problems. And so you end up having a procedure done, or even if not, you can just get osteonecrosis of the jaw, which means the bone is dying because it can't turn over. And then you get abscesses, you get infections, you get fractures. I've seen some terrible pictures that I won't describe, but it's terrible and it can totally ruin your life. And it's almost impossible to fix, right? There's just nothing you can do. Once it happens, you really can't go back. So it's a huge challenge. The other rare but scary thing is this thing called atypical femur fractures. And so as a surgeon, I've treated these. And what happens is, because again, you're squashing bone metabolism, which we never want to do. We always want to have some metabolism. We just want it to be shifted the correct way. But if you squash bone metabolism, the osteoclasts aren't working. The osteoblasts, the ones that are building bone, are still working some. They get squashed too, but they're still building some, but they have nowhere to build it. Imagine trying to build a road without tearing down a road. Right? Like, what are you going to do? You're just going to build on top of the road, right? So you end up with these dense, look better on x-ray and DEXA, but you get these dense bones that are then fragile because they don't have the right morphology. They don't have the right trabecular structure. They don't have the proteins in them to keep them strong. And so you end up with these dense, fragile bones, and the femur breaks in a place where it doesn't usually break. That's why it's called atypical. And they're really hard to fix, and they're really hard to get to heal. And so both of those things are terrible, but I would encourage people, if they can avoid being on those drugs, they should avoid being on those drugs. There is a time and a place, and we don't need to get into that. I've talked about it extensively in my channel, but there is a time and a place for these drugs. I'm not anti-drug. I just think they're grossly overutilized, especially that drug class.
I think oftentimes when we look at medications, we determine to use them by just looking at like some arbitrary number. For example, we want on DEXA scan the bone density to be higher. Right. We don't care how we get there or what happens in the process of it, but yes, we achieved the one goal.
That's right. Yeah, and this is a great example of that. And so we have not only DEXA, but then there's also the FRAX score. And sorry, all these acronyms, but FRAX is a free online calculator, and doctors will use it. So they'll get a DEXA, they'll go to FRAX, and you can do this yourself. If you just go to, I think it's frax.com or whatever it is, you'll find it. And you can plug in all these variables, and it'll tell you what your 10-year fracture risk is, 10-year fracture risk of your hip and of your spine, or major osteoporotic fracture is what they call it. And based off of certain criteria, then there's a recommendation for pharmaceutical management or not. And so the doctors will use this, and they'll say, well, your risk of hip fracture is over 3% in the next 10 years, and you go on a bisphosphonate. A lot of times they'll do it actually before that. But if you cross that threshold, then that's the case. Now, I have lots of patients that are across that threshold that don't want to take the drugs, and we are improving their bone health, and they did not need drugs. But to be fair, what I'm offering and providing them, they could not have gotten from their primary care doctor. So I can't say that the primary care doctor is wrong. We all want to prevent fracture, especially that hip fracture. But the tools that they have are the tools that they have, and there's nothing in the system is going to change that. That's why I encourage people to look elsewhere, and that's why we are treating as many people as we can.
Yeah. Well, do you want to share with us a little bit about this?
You want to talk about a hip fracture? Yeah. So just because I have these fun plastic bones from training. So a hip fracture, when people hear of it, a lot of times they don't know what it is. And I think it's important to understand exactly what we're talking about, because even when you're looking on DEXA, there's all these different numbers: total hip, spine.
One thing to note is if you're listening to this on a podcast platform, come over to YouTube and you can see Dr. Doug handling a bone, a
It's plastic.
Femur?
It's a femur.
A femur,
Yeah, it's a
plastic femur. So as you go along, explain it for those who aren't coming over.
Sure, yeah. So it's a femur. It's the biggest bone in your body. It is the hardest bone in your body, and it is remarkably hard. As a surgeon treating these things, drilling a hole in this bone is like, if anybody's done carpentry, it's like, the hardest hardwood you can imagine. So it's a really remarkable bone, but there are areas of weakness. And for those of you that are watching, you can see where I have my fingers. This is called the femoral neck, femoral neck. And this is where the troublesome hip fractures occur. There are other areas where it can break, but for the most part, we worry about these or this kind of bigger chunky area here called the trochanter. And this is another area where it's not as thick in what's called cortical. It has more trabecular bone. So this is what breaks. And the reason why this is important, and I talk much more about this than I do about spine, is that, yes, spine is bad and it can hurt and it can cause deformity. And yes, we want to avoid that too. But hip fractures, if you fracture your hip in the subsequent 12 months, there's a 30% chance that you will die.
Wow.
There's a 30% chance that you will never regain any amount of independence, that you'll be required to be in a facility or have full-time care.
At what age if this happens?
This is technically over the age of 60, but I've seen this in people under the age of 62, 60 as well. And so then that leaves only 30% of people that have a hip fracture that regain any kind of independence. Of that 30%, though, after 6 months from injury, they still can't walk across the room. So yeah, they regain some level of independence, but they're not normal. So this is why when people say, oh, I'll worry about osteoporosis later, no, because if you have this fracture, it's too late. And it will significantly change the lifestyle of both you and those that care for you.
But the positive thing in all of this is that you can reverse osteoporosis. You just have to know about it.
You have to know your diagnosis, and then you have to be willing to do something about it.
Right.
Yeah.
Well, then why don't you share with us a little bit about this great book that you've written?
This book. So for those that can't see this, so I wrote this book called The Osteoporosis Breakthrough, The Natural Way to Reverse Causes of Bone Loss and Build Strong Bones. We wrote this book because what we realized in the YouTube channel is that this is not just a U.S. problem. This is a worldwide problem. On our channel, we have about a 40% international viewing rate. So we get questions from people all over the country. We have a big following in Canada, in England, in Australia, in various European countries. And the challenge is the same in the US as it is in the rest of the world, which is our healthcare systems. Doesn't matter if they're single payer, private insurance, whatever. There is not a good way to solve this problem in a traditional system. So we wrote this book as kind of a jumping off point. I explain things about the nutrition side that we talked about. I explain gut health. I explain supplements. I talk about exercise and training and different modalities, talk about hormones. And then I dig into the drugs a little bit deeper, talk about all the classes of drugs and who should probably consider them in my eyes. Because I also find the opposite of what we talked about, which is that there are people that really should be, that time and place that I talked about, they really should be on the drugs and they're not because they're afraid or because their neighbor isn't and is afraid. And so I really wanted to get this out there to help people to understand it from a surgeon's perspective, but also from a functional medicine perspective. It's a short read, 150 pages. You can read it in an afternoon, and it's getting really good reception.
I wish I could read 150 pages in an afternoon.
Yeah, they don't have young kids.
Well, and people can find that on Amazon.
Right.
And your YouTube channel is called Dr. Doug Bone Health.
I think it's now Optimal Bone Health with Dr. Doug.
Oh, great.
Yeah.
And then if folks want to find you, if they're looking at needing support for osteoporosis, where would they find support?
Yeah, just go to our website at optimalbonehealth.com. You can chat with one of our team members. I think as of today, I think you can actually download the free PDF of the book. Again, we're just trying to get people as much information as possible. And then you also can get access to our master class, which is a usually every other week class that I run myself. Again, educating people on all of these principles. I think our class, which is the week after next, we have over 2,000 people registered for.
Wow. Amazing.
Yeah.
Can more people join that one?
I don't know. I think we might be maxed out. Yeah. But again, they should be every 2 weeks.
Well, thanks for coming on the show, Dr. Doug.
Thank you. I am clearly passionate about this topic, and it's something that we want to continue to treat and really serve people for.
This might sound unique that we're talking, recording it, but this is really what our lunches sound like together, our dinner meals and bedtime. I'm just kidding, kind of.
We're so lucky.
Well, thanks everybody for tuning in. If you are watching this on YouTube, please subscribe and leave a comment below. I can come get Doug to help me respond to the comments if they're specifically about osteoporosis. I've learned a lot about osteoporosis too, so I know a little bit. And then if you are listening to this on a podcast platform, please follow us and leave a review. So remember, to make the change, you've got to step up. Lead with your heart, train your mind, and don't negotiate with your body. See you next time.